Let's look at an example of how easy and powerful Health Heritage is. We will start with Marie Schrader, a 37-year-old female who has a recent history of breast cancer and is an existing Health Heritage user. To access Health Heritage, Marie goes to her patient portal, in this case North Shore Connect, the portal developed for patients of North Shore University Health System. Marie logs in and then clicks the Health Heritage link. Health Heritage automatically connects to Marie's electronic medical record and looks for updates. They could be derived from Marie's problem list, medical history, surgical history, procedure notes, or pathology reports. Sure enough, Health Heritage examined Marie's record, specifically her pathology report, and extracted from it the details of her breast cancer. On Marie's homepage, we see that Health Heritage also has follow-up questions related to her breast cancer diagnosis. These first questions were already answered by Health Heritage based directly on information from Marie's electronic medical record. Health Heritage asks for these types of very detailed, very specific clinical data. It is the key to creating a family medical history that can help predict an individual family member's risk of getting sick. We can also see that Health Heritage did not report whether Marie had more than one primary breast cancer. Now normally Health Heritage would be able to include this detail, but we have excluded it from this demonstration to show you how patients can also enter missing data. Now notice at the lower left that Health Heritage indicates the source of each piece of information. You can see that Marie's breast cancer diagnosis is labeled EMR, meaning the information came from her electronic medical record. Now, Marie does not have the ability to change any data derived from her electronic medical record, but she can enter a note for herself if she has any concerns about its accuracy. When Marie returns to her homepage, we see at the bottom left the risk reports that were generated by Health Heritage prior to Marie's recent cancer diagnosis. We see that she was at population or average level of risk for these common cancers. When Marie decides to update her risk reports by clicking this button, we can see that her risk levels have changed. She is now at potentially increased risk for breast cancer in any remaining breast tissue, as well as for ovarian cancer and pancreatic cancer. When she views her breast report, we see that Health Heritage recommends that she consider genetic counseling. The reason Health Heritage can produce these reliable risk assessments and recommendations is because the software that drives Health Heritage was written to currently include more than 400 unique, specially designed algorithms or electronic rules. Health Heritage also provides full reports with much greater detail and additional potential contacts for Marie if she wishes to learn more. Again, all information contained in these reports are pulled from scientifically vetted sources. Now, let's look at yet another unique and powerful feature of Health Heritage, the family sharing function. While the choice to share your medical history with a family member is entirely up to you, most people will likely see great value in expanding their family medical history to include the personal information of their closest blood relatives. You can see on this family sharing screen that Marie is currently sharing medical information with her brother Jesse. After her breast cancer diagnosis, Marie talked to her sister Skylar, who had just had an appointment with her doctor. Marie asked whether Skylar had mentioned Marie's breast cancer diagnosis during the visit. Skylar said her doctor had not asked about it, so she thought it was not important. Marie suggested that Skylar register for Health Heritage so that Marie can share her medical history with her sister. That way, Skylar can run her own risk assessment report and see if she needs genetic counseling too. Skylar had agreed, so Marie requested a unique sharing code, which she sends to her sister before closing her Health Heritage session. Now, let's see what happens when Skylar, who is also a North Shore Connect user, logs into Health Heritage. Since Skylar is using Health Heritage for the first time, once she logs in, she is going to be asked to agree to the Terms of Use page. If Schuyler had already created a family tree in the U.S. Surgeon General's tool called My Family Health Portrait, she could import that information here. Health Heritage now examines Schuyler's electronic medical record and confirms that she has been diagnosed with hypertension. Health Heritage walks Schuyler through different categories of conditions that Health Heritage is interested in, starting with cancer and then cardiovascular conditions. Schuyler can add conditions for herself or family members in these steps, such as diabetes for her mother, who was recently diagnosed. Notice that Health Heritage has information buttons next to all medical terms. Users can click on these buttons, which will take them to the National Library of Medicine's consumer page for detailed definitions. After Schuyler lands back on her homepage, she can start adding conditions or test results for herself or her family members. She can also add relatives to her family tree, or she can respond to the follow-up questions that Health Heritage has generated for her. First, Schuyler decides to add Marie to her family tree. Schuyler can now jump over to Family Sharing and enter the code that Marie gave her. As part of the Health Heritage family sharing process, all of Marie's medical information will be transferred to Schuyler's family medical history. When Schuyler runs her risk report, she sees that because of Marie's breast cancer diagnosis, she herself is at potentially high risk for breast, ovarian, and pancreatic cancer. Schuyler also finds that she is at population risk for colon, melanoma, and uterine cancer. But most importantly, Schuyler's breast cancer summary report suggests that she make an appointment with medical genetics to discuss her history and the possibility of genetic testing. Schuyler decides to share this report with her doctor by clicking this link. Now, when she meets again with her doctor, she agrees that she should make the appointment for genetic counseling.